Hi everyone, it's Nilanjana coming to you with a video titled Diabetes. What is diabetes? So when we eat food, any food, the body then secretes insulin in response to that food. This is so that we can use the food as fuel, we can burn it and the body can use it any which way it wants to. So the insulin secreting parts of the body are responsible for keeping the sugar levels nice and uniform. So if we eat food and insulin is not secreted, then is the problem. So then we have lots of sugar running around in the blood, the body not knowing quite what to do with it because the insulin is missing. Why is the insulin missing? It is because, number one, the patient did not have insulin secreting cells to begin with, so he can't secrete insulin. And number two, the insulin secreting cells have become very tired. After many, many years of secreting insulin, they have become tired. And they might have also become unresponsive. So the insulin receptors are, not reacting so well. So this is the background of diabetes. Now, diabetes is, yes, a lifestyle disease. That is true. But it is also an autoimmune disorder. So especially in people with type 1 diabetes, this is when they don't have enough cells to secrete the insulin. So that's why type 1 patients go on insulin from day one, because their body doesn't have the insulin. Now, in case of type 2 diabetes, which is sadly the commoner one, this is usually maturity onset diabetes. So what is maturity onset? It's when the cells in the pancreas have been secreting insulin for years and years and years, and they are exhausted. They're not able to secrete any more insulin. And sometimes the receptors of the insulin, so when the insulin reaches a cell, the cell has to receive the insulin. So these receptors also become unresponsive. So in both cases, the body is not getting enough insulin. So either the cells are tired, receptors are unresponsive, they are exhausted, all of those things. So that is usually maturity onset diabetes. So this is why we then ask the patient to eat low sugar, low carb diet, because the more sugar the patient eats, the more insulin has to be secreted by the body, and therefore, the situation becomes more complicated. However, this is where I think intermittent fasting is a brilliant a technique to rest your pancreas, to stop the cells from secreting insulin, because obviously if you don't eat, no insulin secretion happens. So if you can try intermittent fasting, that is probably one of the good things about control of diabetes. And obviously you have to have a diabetic diet, which means you're avoiding carbohydrates and sugars, and you're also getting enough exercise. So this, in a very, very tiny nutshell, is diabetes. If you require any further information, you've got any queries, please don't hesitate to post them down below. Thank you for listening.